Hi everyone. So let's start our today's topic about respiratory distress syndrome. So, respiratory disorder syndrome or respiratory distress syndrome, a condition of a newborn when, regardless of the causes of its development, the function of the external respiratory system is insufficient to provide the body with the necessary amount of oxygen and carbon dioxide or maintaining sufficient gas exchange. It's ensured by straining the compensatory functions. Terms respiratory syndrome or respiratory highly membrane disease are often used to describe the same pathological. In recent years, many authors don't use the term respiratory distress and as synonyms for highly membrane disease, since other pathological conditions are known in which highly membranes are formed. In Russian literature, the terms respiratory distress syndrome and respiratory disease disorder syndrome are used to describe the same condition. What about etiology, structural and functional immaturity of the lungs, insufficiency of surfactant formation, violation of surfactant structure, increased destruction or inhibition? Causes of development of respiratory distress syndrome, pulmonary causes, pneumopathy, highly membrane disease, pulmonary atelectasis, meconium aspiration, pneumonia also. What about extrapulmonary asphyxia, congenital heart disease, hypovolemia, acidosis, anemia, birth injury? There are the picture where you can easily understand the pathogenesis of this disease. So if you notice here starts the process ischemia. Because of ischemia starts the process acidosis. Because acidosis, you can see leakage of the leukocytes from the bloodstream to tissue, and after it, they can easily go into the alveoli and can lead to the forming of the hyaline membrane, and also can lead to uh, um, the forming of the necrosis in this area. Functions of surfactant, as you know from the another subjects, it is prevents alveoli from collapsing during exhalation, protects the lungs from bacterial damage, stimulates mucociliary clearance, stimulates macrophage reaction, and clinical sign of respiratory distress syndrome, including anxiety or depression, tachypnea or bradypnea, onset of apnea or asphyxia attacks. It may be during 10-15 seconds. Involvement of accessory muscle in the act of breathing causes difficulty to breathing, a pathological type of breathing, convulsive, paradoxical, and cyanosis after cyanosis. What about character of dyspnea? First one is rapid change from rapid breathing, slow breathing, with long pauses. Significant discoordination of chest and abdominal breathing with retraction of the sternum on inhalation. Discoordination of respiratory swallowing and sucking movements at normal temperature and hypothermia. And dyspnea may be accompanied by coughing. We use Silverman scale to assess the stage of the respiratory syndrome. Zero stage, well, everything okay. With stage 1, you can see lack of synchronicity, slight retraction of intercostal, xiphoid processes, and lowering of the chin on inhalation, and expiratory sounds are heard in chest auscultation. What about highly membrane disease? The most severe form of respiratory syndrome is more will be seen common in premature infants, can occur in full term also if they experience intrauterine or neonatal hypoxia, and characterized by the deposition of hyaline-like substance on the inner surface, of the bronchioles and alveoli, which impedes gas exchange. Radiological signs of highly membrane disease, atelectasis of lungs, causes of occurrence. And what about atelectasis variants? There are subsegmental, segmental, polysegmental, lobar, total, and scattered. Clinical picture, clinical manifestation depends on the size of the atelectasis and the cause of its occurrence. With a minor lesion, clinical manifestation may be absent. With massive lesion, the clinical picture of respiratory insufficiency, short failure, shortness of breath, shallow breathing, dyspnoea, dullness of percussion sound, or complete absence during auscultation, breathing. What about meconium aspiration syndrome? Observed in post-term, full-term newborn who have experienced intrauterine or intranatal hypoxia occurs as a result of meconium aspiration with the development of an inflammatory reaction such as chemical pneumonitis with subsequent infection, may be accompanied by pulmonary edema, the formation of atelectasis, the presence of mobile plaques in the bronchi, contributing the stretching of the alveoli with their subsequent rupture and the formation of pathological air accumulation in the chest. Variants of the clinical symptoms may be from birth, signs of severe respiratory failure, attacks of secondary asphyxia, dyspnea, dullness of the pulmonary sound, moist trails of various sites in lungs in auscultation you can notice. Transient tachypnea of newborns. It is wet lung syndrome, intrauterine pulmonary fluid retention syndrome. Causes acute hypoasphyxia during childbirth, excessive drug therapy of the mother during childbirth, especially excessive administration of oxytocin, and clinical manifestation including dyspnea is the main symptom. It appears and increases from the first minutes of life over several hours. In the second half of the first day of life, it intentionally decreases. There may be an edematous skin fold above the lungs. The chest is barrel-shaped. A box-like shape of percussion sound may be heard. What about bronchopulmonary dysplasia? It is acquired chronic polyetiological obstructive pulmonary disease, developing as a result of respiratory distress syndrome of newborns and artificial ventilation of the lungs, accompanied by hypoxemia, altered bronchial reactivity with hypersensitivity of the airways. Factors: respiratory distress syndrome, hereditary predisposition, maturity, toxic effect of oxygen, infection process. Radiological stage including 4 stages. And history of mechanical ventilation, it is bronchopulmonary dysplasia criteria. Persistence of respiratory failure symptoms at the age of 28 days. Characteristic radiographic change, need for oxygen support. Here you can see like oxygen support, and you can see acrocyanosis with characteristical disease. Here X-ray of the chest, you can see the characteristical manifestation or appearance of this disease, like diffuse decrease in the transparency of the lungs, failed reticulogranular reticulation, here you can see, and the presence of streaks of enlargement in the area of the root of the lung. As you see here you can see this appears. What about diagnosis? A foam test, remember, is also used when ethanol is added to a liquid containing surfactant and shaken. Foam is formed. These same methods can also be used in prenatal diagnostic and should be, but the question of amniocentesis should be decided individually at the pregnancy term of at least such 2 weeks. And what about the most common informative test is the determination of the ratio of lecithin to sphingomyelin in amniotic fluid, tracheal fluid, or aspirate of stomach contents at birth. If this indicator is greater than 3, then the lungs are mature. And if less than 2, then the risk of developing respiratory distress syndrome is very high. Thank you for attention.